Competitor number 9, Melissa Foxley, is a PhD student in chemistry and biochemistry whose presentation is titled No Mercy for MRSA.
Experts predict that by the year 2050, there will be more annual deaths caused by antibiotic-resistant superbugs than from cancer. One of those superbugs is MRSA, a dangerous pathogen that causes staph infections but cannot be treated with conventional antibiotics. Normal, non-resistant staph infections are very common and can be easily treated with medication. However, if the staph infection turns out to be resistant to the antibiotic, the infection will not be effectively treated right away and will continue to grow and spread, which has happened to this patient here in the middle. Then, the patient must undergo more vigorous treatments, and in some instances, even have the infected area amputated. Due to this delay in treatment, 1 in 7 individuals infected with MRSA will end up dying from their infection. Thus, there remains a strong need to develop new antibiotics in order to combat antibiotic-resistant bacteria. Hi, my name is Melissa Foxley, and I'm a PhD candidate in the lab of Dr. Rice in the Department of Chemistry and Biochemistry. My research involves using a non-toxic chemical called BPEI that we have found makes MRSA susceptible to the previously ineffective antibiotics such as amoxicillin. We have also found that BPEI works through a unique mechanism that has never been investigated before. Specifically, bacteria have cell walls that are necessary for their survival. Now, if we relate the cell wall of MRSA to a real-life wall, we would need a crane to build it. In a normal staph infection, amoxicillin would come in and destroy the crane and kill the infection. MRSA, however, has extra workers that could continue to build the wall even if the crane is destroyed. What we have found is that BPEI would prevent those extra workers from getting to the wall in the first place, and thereby kill the infection. Although BPEI is very successful in killing MRSA, it is not toxic to human cells or to mice. Combination therapies are used to treat a variety of ailments, and it is our hope that in the future, BPEI would be prescribed in combination with amoxicillin to treat all staph infections. This would prevent the infections from getting worse in case the infectious agent is in fact MRSA, and therefore increase the likelihood of success. Our method shows MRSA no mercy, but it is our hope that one day we can provide mercy to millions of patients around the world. Thank you.